Congratulations on the arrival of your baby. Before you go home, we'd like to talk through what to expect, how to look after yourself, how to care for your baby, and how to escalate if you need any help.
If your baby remains in the neonatal unit, then your postnatal appointments will be arranged for you in the hospital. Otherwise, you will have a community midwife visit you the day after you go home. If you have not received this appointment by 4 p.m, then please contact us. You will also receive a visit or phone call on day 3, a visit on day 5, and a visit around day 10. The body needs time to recover after birth. It is normal to have vaginal bleeding for up to 6 weeks. We would expect this to gradually get lighter. Please seek urgent medical advice if you have any of the following important symptoms: a temperature above 38 degrees, any redness, pain or swelling in the legs, any foul-smelling discharge, any headaches or visual disturbances, or any heavy bleeding, which includes saturating pads frequently or passing any large clots. You may have had a caesarean birth or a vaginal birth requiring stitches. Please ensure to keep these areas clean and monitor for signs of infection, including redness and inflammation, an abnormal smell, any increasing pain or oozing.
We recommend that you start pelvic floor exercises as soon as you feel comfortable to do so. This will aid healing and help reduce any bladder problems or incontinence in the future. If you are unsure how to complete pelvic floor exercises, please speak to your midwife or access information on the NHS website. You can become pregnant as little as 3 weeks after you give birth, even if you are exclusively breastfeeding and your periods haven't returned. Your midwife can discuss contraception options available to you prior to your discharge. If you are undecided about contraception, you can also discuss this with your GP surgery or your local sexual health clinic. You can feel overwhelmed, tired, and sometimes anxious, and this can be normal. However, if you are feeling persistently low, if anxiety is increasing, perhaps you're not bonding with your baby as expected, then please escalate this to your community midwife, health visitor, or GP. If you are unable to speak to someone about this, you can also self-refer to talking therapies through their website. All babies cry. It's how they communicate with us. However, it can be very overwhelming, particularly if they're crying for prolonged periods of time. We would always suggest that if you feel overwhelmed or if you're struggling with the crying, that you put your baby down in a safe space, such as their cot, where no harm can come to them. We would always say to never shake your baby in a moment of distress. You can find helpful advice on how to cope with crying through the ICON programme on our website. Sudden infant death is rare. However, there are a few ways that we can reduce this risk. For starters, we suggest that babies always sleep in your room for the first 6 months of life. We suggest that they sleep in their own cot on a flat, firm, waterproof mattress.
Ensure to keep the cot clear.
You should always put baby to sleep on their back. Their feet should be at the end of the cot to avoid them sliding under any blankets. Ideally, the room temperature should be between 16 to 20 degrees. Smoking can increase the risk of sudden infant death syndrome. If you would like any information on how to stop smoking, please let your midwife know and she can refer you. Co-sleeping increases the risk of sudden infant death syndrome. Please avoid co-sleeping with your baby if you smoke, have taken any medication that can make you drowsy, or have drunk any alcohol. You can find all the latest up-to-date information on safe sleep on the Lullaby Trust. Contact your midwife or GP urgently if your baby experiences any of the following symptoms: a high-pitched or weak cry, if your baby is less responsive or becoming floppy, pale all over, any signs of jaundice, which includes yellowing of the skin, the whites of the eyes or the gums, if your baby is experiencing any symptoms of respiratory distress, including grunting with each breath or breathing faster than normal, if you have noticed that your baby is not interested in feeding, if there's been a reduction in the urine output, or if your baby has reached 24 hours of age and has not yet passed urine or opened their bowels. We would also ask you to monitor baby's fontanelle. If this is swollen or sunken, this can indicate infection or dehydration. if your baby has a high fever or is sweating, or if there's any blood in the stools. Call 999 immediately if you notice your baby is blue, unresponsive, not breathing, having any convulsions, if they have a glazed over appearance, if they are having any green vomits, or if they have a rash which is not disappearing under pressure. And remember, trust your maternal instincts. If you feel like something is not right, escalate to a health professional.
We recommend responsive feeding. This means monitoring your baby for early feeding cues and being aware of how your breasts are feeling. You should spend plenty of time in skin-to-skin contact and cuddling your baby. This helps to develop the bond between you both and supports a healthy brain development. We recommend that your baby feeds 8 to 12 times in a 24-hour period. They may feed more than this. This is normal and is called cluster feeding. It is also normal for babies to feed regularly through the night. There is never a wrong time to breastfeed your baby. Signs your baby is feeding well. They will be having regular wet and dirty nappies. They'll be settled after a feed. You will find breastfeeding comfortable. They'll be feeding regularly. And when we weigh your baby, they will not have lost more than 10% of their birth weight. If you are breastfeeding, a member of our team will complete a breastfeeding assessment prior to you going home. They will observe a feed and ensure that you feel confident with positioning and attaching your baby to the breast. They will also discuss ways you can check that your baby is feeding well. If you are formula feeding, it is important to know how to safely make up a feed. Your midwife will discuss this with you on an individual basis before you go home.
We recommend that your baby travels in a car seat. Always use a rear-facing car seat with the straps fitted snugly. Avoid prolonged periods of time in the car seat. If you are making long journeys, please ensure that you make regular stops. And once you arrive home, please remove baby from the car seat, even if they're sleeping. You will need to arrange a 6 to 8 week check with your GP, one for you and one for your baby. You will also need to remember to book the birth registration appointment. This is where you will receive your baby's birth certificate. You have up to 6 weeks to do this. We hope that you have had a positive birth experience. If anything about your care or your birth is worrying you, please speak to your midwife before you go home or in the community. We are here to support you. Alternatively, you can speak to the Maternity and Neonatal Voices Partnership. We are constantly looking to improve our services. Before you leave, we would really appreciate if you'd fill out our family and friends survey. Thank you for watching this video and congratulations again on the arrival of your baby.